make a statement. My disclaimer is that I'm 72. AI terrifies me.
Yeah.
And for the jobs that it may enhance or create, I always think about the jobs that it's going to take away. So I know that as we go forward in that whole AI sphere.
Billing and collecting is kind of a bread and butter set of activity for AI. So there's a lot of work in that space that I still think to its core, it's only going to make people more productive. We are not going to displace people. What I've tried to say to our employees is we need all 39,000 of you.
Good.
But what I may need you to do is be open to new jobs, retraining, thinking about new things. But if you've decided you want to be a part of a healthcare organization, that's a major commitment already. And so we want to keep those people because they could do billing someplace else. They could do IT someplace else. They could do HR. They've already decided this is an important industry. And so we want to keep them in the industry. Yeah, it's, I think in our industry, it is a deeply personal industry that you're talking to people at their most vulnerable moments when they're sick and scared, and lots of other emotions come out when you have health issues. AI is never going to replace that.
Welcome to the Second Half Podcast. We are excited to be here today with Dennis Murphy, who is the president and CEO of IU Health. And I am joined by my co-host,
Thomas Griffin. Yeah, I'm going to say my name because, just in case I forget, I'm over 50.
Listen, we cannot forget our names yet.
Okay. Yes. I've got that under control.
We're 50 and thriving and doing well. So, Dennis, thank you for being here with us today.
Well, thank you so much. It's a real honor to be here. And I love the idea of this podcast. As somebody who's now over 60, it also has new meaning that I think they always say 50 is probably the new 25 and 60 is the new 35.
Well,
so
I was real hot and sexy when I was in my 60s, but I'm not that anymore.
You're doing all right.
You're doing all right. That's what I'm saying. This is the guy who doesn't take any sort of medication. He told us that in one of our previous recordings, and I'm like, you go.
Fabulous.
Yeah, right. That's amazing. So this actually is our third time having a conversation, because our first conversation was with Ashley Gervitz.
Yes.
Over on the east side of Indianapolis. We had coffee at the Dunkin' Donuts over there.
I remember that.
Remember that a few years back. Great conversation. My first time meeting you. And from that conversation, we then had a conversation with Jim Ryan, the CEO of Old National Bank, which is my employer. You were nice enough to just join us for a brief conversation virtually, and we just got to know one another. So this makes our third time being together. So I appreciate just the fact that we're continuing the conversation.
Three times is a charm.
That's right. That's right. And now I'm joined by my co-host. So thanks again for being here. We're looking forward to learning more about you. Maybe if we could start with you sharing a little bit about yourself with our audience for those who may not know you.
Sure. So my name is Dennis Murphy, and I've been here in Indiana now 13 years. I started out as the chief operating officer, which is kind of the number 2 person at IU Health for the first 3 years. And I've been a CEO for the last 10 years. Here, I have spent my entire career in academic medicine. So I have never worked any place that had less than 10,000 employees. So I like big, complicated things. But I always tell people, really formative part of who I am. I was actually a Franciscan seminarian studying to be a priest for 5 years. Early in my life. And the other is that my parents were both from Ireland. So I am the son of immigrant parents. And so probably in today's political climate, I have a lot of feelings and opinions because my parents, I think like lots of immigrants, came here because this is the land of opportunity. And they really believe strongly in that. They missed what they always refer refer to as home, but they would never move back because of all the good things that happened to them here in this country. And so they, like lots of immigrants, emphasized education and hard work for me and my brother and sister. And it's kind of very much a part of who I am. I think it makes you humble and connected to people if you realize you came from a fairly simple background.
Right,
Yeah,
right.
really
So
good.
as a first generation, I'm just listening to you now, and I got a whole different kind of mindset, because it appears that you will have a different kind of feel for some of the problems that go on in our community and in the healthcare industry.
I hope so, a little bit. I always have learned I'm kind of an introvert and a quiet person. And so for me, a lot of what I do is ask questions and listen and learn. I came from a big Irish family, and I was always the one in the corner listening. There was lots of chaos around. I didn't need to be a part of it all the time. But that sort of ability to kind of see and hear and listen, I think is a component of what's helped me be successful in my career. And that also for me is simple. My dad was a plumber and a building engineer. My mom was a checkout person at a grocery store and a bank teller. So those are my people. It's easy to relate to them.
Empathy, sympathy, and grassroots base.
Yeah.
And that's what makes you a well-rounded guy.
And I always love, in our organization, we talk about our values as purpose, compassion, teamwork, and excellence. Yeah. And I love the idea of compassion as actually empathy in action. So I can be empathetic with you, but it's more important for me to actually say, I'm also going to do something about it to help you improve your situation. And so we want that to be an active kind of action for people that are working at IU Health. And that's what healthcare is all about, is really that active desire to help others. It's why I love the work I do. Is I'm surrounded by 39,000 people who are trying to do good every day.
Yeah. No pressure, 39,000 employees. Yeah. When you talk about compassion and we think about our audience, those who are over the age of 50, and we think about the IU Health District and the new hospital that is being built, and the residents in particular that live in that corridor and the life expectancy of those residents, what are some of the things that you would maybe share with us as we look at the difference between their life expectancy versus those who might live more in the suburbs of Indianapolis?
Yeah, so it's sort of interesting, and it's repeated throughout the country that urban areas consistently have lower life expectancy than what you would see in affluent suburbs. Yeah. And some of that, when you look at what drives health outcomes, what we do every day at IU Health in terms of providing care is about 20% of your health outcome. Genetics play a big role in that. We were talking earlier, Thomas, you got some blessed genetics.
Yes, I do.
You're not on any medications.
But also don't smoke, don't drink, don't get high, some of the other stuff.
And that's actually the largest component, is really your environment and your lifestyle play a much, much bigger role in terms of your health. And so for IU Health, as we started this project downtown, we had kind of a standard phrase we used, which was, if all we do is build a great hospital, we would have failed, because we would have only dealt with that 20% that we can control. And we really want to have an impact on that life expectancy and all those other things that determine people's health. And it's kind of interesting. That's everything from housing to food access to safety to education to job opportunities. And what I've kind of learned watching others deal with this is there's no one thing of these kind of indicators that drives life expectancy. You actually have to lift them all up to be successful. And so that's really the idea behind the Indy Health District, was how do we have a dedicated set of resources and efforts that are just as important to us as building this new hospital. And every time I run into people, they tell me, boy, that building's beautiful and I can see it.
Right.
Just as important are all these things that people may not see. Mm-hmm. So whether it's our Mosaic Center, where we're trying to actually create pipelines for people that are as young as high school to people over 50 who are looking to get retrained, to understand, is there another career for me after 50 that I can use the skills I've developed in my life to put towards something really meaningful. And again, that's part of what we're trying to attract, is people who are trying to make a difference and help others. That there's lots of jobs in healthcare. If you watch TV, you think there's two jobs in healthcare, right? You think you're either a doctor or a nurse. We have 13,000 different jobs, everything from, we need engineers, we need accountants, we need everything in between. And so I would encourage people who see this podcast, if you're really looking to make a difference and do purposeful work, come talk to us and come to the Mosaic Center and tell us what skills you have and what skills you'd like to develop, and let us find that match. That's part of what we're looking to do.
So rather than me being a checkout guy at Walmart or something like that, do you have jobs that would be geared towards people in that 50 and over area?
Absolutely. So there's a list that our team at the Mosaic Center has that's about, I want to say it's about 30 different jobs that we could say, if you're new to healthcare and you want to come in, we can get you trained and ready to take these jobs.
Okay, now I'm going to throw you a hardball.
Sure.
When we're talking about jobs, are we talking about jobs for retired people or jobs that might have a living wage?
Every job at IU Health has a living wage. So it's been one of the commitments we've made. There was some really great work done by the Central Indiana Corporate Partnership a few years ago with Brookings that said what a living wage is. And it's not just the wage, it's actually benefits.
Yes, wage and benefits.
And sort of how flexible you are as an employer. So we call them good jobs as opposed to just a living wage, and really thinking about all the dimensions of that. Now, I think it's increasingly challenging, right? Because the rate of inflation, we're not going to change the wage every time the price of gas changes at a pump, but we are going to try and keep up with that. So the other thing that I think is really important in a place like ours, so we talked about how many employees we have, is the ability to grow and change in the organization. One of the great things I get to do is celebrate employees who have been with us for a long time. So we have employees who have been with us 25 years, 30, 40. We actually have a handful of people who have been with us over 50 years. And I always ask them, tell me what you've done here in your 50 years plus at IU Health. Not a single one of them has had one job the whole time.
Yeah.
They've all changed and evolved and grown. And I think that's really important for people to have that ability to grow and expand and change as you get older, as your interests change, as your life needs change. I have 3 kids, so my kind of work-life balance was different when they were young than now. They're all out of college, or I've got one close to it. She's a senior, that I can think about my work-life balance a little differently. So I'm really conscious of the idea that everybody's got stuff to balance in their life.
Right.
I love that, because I hear the approach with the Indy Health District is very holistic, right? So you're not just thinking about one aspect of a person's life, but then you're also thinking about people who may retire that are very skilled, right? So we have everything from the possibility of being an engineer to maybe being a person that does another job or has another skill set. So I love that you're kind of running the spectrum there. When you talk about employees that have been with the organization for a long time, I have to say this. My sister sees Dr. Pascuzzi. I don't know if that name rings a bell.
One of my favorite people.
I went to one of her appointments with him recently, and I was completely impressed by him. I have never met a doctor that was that compassionate, that sensitive, and just really remembered things about her kind of on a dime's notice. Just a really powerful interaction. And I think it really speaks to you as a leader and the way that you lead the organization, and then the way that your employees kind of interact with the community. And Dennis, I'd also like to say that I'd love for you to speak about when we think about employees and employment and growth and opportunities. One of the conversations that we've consistently had on the podcast is around AI.
Yes.
And I think it's a really good question for you as you're leading 38,000 employees. And how are you implementing AI, and how is it impacting the workforce, and what do you anticipate in the future?
And how many AI doctors do you have?
Zero today.
Zero.
Good.
So AI is a really interesting question. So I'll start maybe first going back to Dr. Pascuzzi, because he's a great role model probably for all of us over 50. He is a neurologist who has been incredibly successful throughout his career, to the point where he became the chairman of our neurology department. So he was leading a team of other neurologists. And then he decided at a certain point in his life, he only had so many more years left to work. He was going to do the things that brought him the most joy in his work life. And he stepped down from all of his administrative responsibilities and said, I just want to take care of patients and I want to teach students. And those are the two things that he really loves. So I think for all of us as we get older, figuring out that thing that brings joy and purpose to your work so that you keep going.
Yes.
Like you don't have to stop at a defined age, but you probably have to find something that builds the passion, builds the desire to say, I want to keep doing something and work really hard and make a difference. And so for me, he's been one of those really great role models.
He's amazing.
In terms of how we do it. And I'm going to apologize because just as I got on my train with him, I thought, okay, I lost my thread on your question.
On AI.
Oh, AI.
The role of AI,
For us, there's probably three different lanes for AI. One is like any other business, we have a whole set of corporate functions, whether that's finance, HR, IT, that you see AI beginning to think about how to automate things. So just a simple process of how do I schedule my clinic appointment? AI can help say you wanted to be seen this week, but I don't have any space downtown. AI will figure out the 5 other places in the Indy metro area that you could be seen, offer those up to you, and make that process really efficient and fast. Billing and collecting is kind of a bread and butter set of activity for AI. So there's a lot of work in that space that I still think to its core, it's only going to make people more productive. We are not going to displace people. What I've tried to say to our employees is we need all 39,000 of you.
Good.
But what I may need you to do is be open to new jobs, retraining, thinking about new things. But if you've decided you want to be a part of a healthcare organization, that's a major commitment already. And so we want to keep those people because they could do billing someplace else. They could do IT someplace else. They could do HR. They've already decided this is an important industry. And so we want to keep them in the industry.
Well, I'll make a statement. My disclaimer is that I'm 72. AI terrifies me.
Yeah.
And for the jobs that it may enhance or create, I always think about the jobs that it's going to take away. So I know that as we go forward in that whole AI sphere, we'll figure it out.
Yeah, it's, I think in our industry, it is a deeply personal industry that you're talking to people at their most vulnerable moments when they're sick and scared, and lots of other emotions come out when you have health issues. AI is never going to replace that. And the other part that I haven't figured out is AI is not going to be in the operating room. taking
Thank you.
care of you. AI is not going to be in the intensive care unit. It'll assist and it'll have some tools to help people. But at the end of the day, these, again, are human. We're a very human business. So I think in the clinical lane, we will be more conservative because the risk of getting things wrong is so much higher. So if I mess up your clinic appointment, nobody dies. Nobody gets hurt. I do need to fix it, and and AI may get that wrong. But if something goes wrong clinically, we are really conservative.
Good.
And so there are tools that are being used to help in radiology read films and highlight ones that they may say to the radiologist, you may want to look at this one. It looks strange or it looks really unique. So it helps prioritize work, but it doesn't replace the work. So, and then the last piece, I think, like every organization, I don't know if you all use Copilot or any other tools.
We got
to get you a Copilot, Thomas.
He's a good friend of yours. I'll introduce you to him later.
All right.
But it's a simple way, I think, for individuals to be more productive. And even I'm 62 and old dogs can learn some new tricks. And so as I think about things I have to write, I either write them myself and then ask Copilot, hey, edit this for this type of audience, and it makes recommendations and you can accept them or not. If I need a first draft of something, I can say, here's the audience, here's what I'm looking to convey to them. It'll put something together. It's never right. It's never perfect.
You still have to go back and tweak it.
But it's always easier at least for me to edit something than to start kind of whole cloth new. So I think for that individual productivity piece, lots of people are finding lots of ways to use it. And I think we're just trying to encourage people, don't be afraid.
Right.
Okay.
And give it a try.
I think it drives efficiency, right? And that's kind of what I hear and what you're sharing is the ability to be more efficient. And when you're running a 38 or 39,000 employee organization, you want to drive efficiency.
And you want to encourage people to innovate. So one of, I think our kind of core beliefs is we can always get better. Like each of us, and thinking about performance improvement and improvement every day is whatever your job is, pick a part of it and see how could you do that a little better. And that may not be only with AI. It could be with other tools, different ways to think about your work. But we'd like every one of our 39,000 people to be saying, how could I do my job a little better or a little differently? And the organization will get better as a result of the majority of people thinking that way.
And the care is better.
Well, and that's where I was getting ready to go. Here's my question about getting better. So again, as a seasoned humanoid, just being able to get into the doctor. I've been a black man for a long time. Black men usually don't go to the doctor.
Yes.
And then when you try to go or you need to go, you have to wait a month, 2 months, 3 months just to get in to see somebody. So has the climate of the medical industry changed? Are there less doctors? You're making too much money, so you don't really have time for these little pity-patty things. How is that kind of coming together for just the average guy that says something's wrong, I need to go to the doctor, I can't get an appointment, I need to go to the emergency room? All those little things that affect people in my age group. She's still a baby. In my age group, that make you concerned about the whole medical field overall.
Yeah, part of it starts with demand for services. So we are seeing the most rapid growth of an aging population in U.S. history. So every day, 10,000 people become eligible for Medicare. They get to turn 65.
Wow.
And that's going to continue for another 4 years, so till 2030. And then you'll start to see those numbers decline. And as you get older, you have more healthcare needs. So the demand side of the equation is increasing dramatically. On the supply side, in terms of ability to take care of people, I would say it varies a lot by what do you need. So if you are looking for a primary care physician, I would say harder. because they don't do surgery, they don't read images. As a relative pay scale in our industry, they are in the bottom quartile. And so we need more. And what we've done is say we'll get nurse practitioners, we will get PAs, we will get other people around those primary care physicians to expand the team to create more capacity to see more people. And I think that even extends to telemedicine, to be able to extend and say, how sick are you really? If you've got something, can I give you a telemedicine appointment and can we handle this over the phone versus you driving all the way downtown or all the way to another one of our locations and spending the time to do that. So I think being creative about how you expand primary care capacity. And then I think in every specialty for us, we look at how many days does it take for you to get a new appointment in. And that's how we develop a 5-year recruitment plan across all of our hospitals, all of our clinics. And we look to get, for primary care, it should be 1 week. And for specialists, no more than 2 to 3 weeks. Now, we don't hit that goal, especially in some really complicated ones. So neurologists are a great example of there is a national shortage, psychiatrists, a national shortage. So we're trying to train our own, keep our own. I maybe simply say I don't have to fix the national problem. I got to fix IU Health's problem. So I try and stay really focused and say, can we meet the needs of the patients who want to come to us?
So here's another question. So for folks over 50, do you have a recommendation? Do we have to have a primary care doctor? Do we have to have an annual checkup? What are the things that you say, hey, once you get to a certain age, these are things that you should really do, or at least concentrate on?
So I'm going to start by saying I am not a clinician. But, so everything I caveat, but I did get some notes before I came, and I would say everybody should have a primary care physician, and mostly for preventative reasons. So, a really interesting program we have in the health district is we call it our barbershop initiative. So we have in barbershops in the health district screening for hypertension. So this is high blood pressure. 78% of the people that we test in the barbershops have high blood pressure. Half of them didn't even know they had it. So they're not taking care of it. They're not aware. The medications are some of the least expensive medications you could take to solve a really serious problem. And so if you're going to a primary care doctor regularly, screenings for hypertension, screening for hyperlipidemia, so your risk of a heart attack, behavioral health screenings, all kinds of things that will prevent you from getting bigger, more complicated problems down the road, I think are really important.
But regularly, once a month, once a year?
Once a year. So what I start is once a year, and then your doctor will tell you if it's got to be more or less depending on your issues. You're vibrant, healthy.
I'm an anomaly.
Yes, you may be on the 1 a year plan. I'm on the 1 a year plan, but I think it's depending on the individual. That's most important. The other things that I think, though, are really important, I'll go back to our beginning conversation of 80% of your health is not what you and your doctor are going to do together. It is your lifestyle, your environment, and there's lots of interesting components to that. So a really interesting part for me is social isolation has a really detrimental impact on people's health. And I'm fortunate, my mother's going to turn 90 this year. She is somebody who is out to lunch, out at events. She's walking. She goes to church regularly. I think that's part of why she's 89 and healthy
Sure.
is her level of engagement and activity with others. So I think there are lots of parts to health that go beyond being a regular patient, and thinking about screening is what are you doing to keep yourself active?
Right.
I'm a big believer that motion is medicine. So just keep moving, do something, walk, exercise, be engaged with others, find somebody to do that with, kind of an accountability partner. There's lots of things outside of the medical field formally that we can do to improve our health.
So now I know when I was coming up, Methodist Hospital was the big dog in the neighborhood seemed to be.
Yeah.
Now you've taken that whole area and expanded, and now you've expanded some more. How big is the area that you'll be working from? Blocks at a time? And is there an open door policy? Is there a marketing plan to get people to come and check it out? Are you ready to have a grand opening? Give us some background.
Yeah, so we're really excited. So part of the conscious planning of the new facility was how do we make this engaging for the community? And so you'll see, I sort of think of that area as everything from the Highway 65 north to 21st Street. And we've built on 16th and Capitol in that corner with one building on the other side of the Capitol Street. All of the first floor activity will be retail activity. So if you go by there today, there's not a restaurant, a store, a dry cleaner, anything for anyone to engage in that neighborhood. And there used to be a shoe store, but that was about it. So we're really trying to activate that so that it becomes a place that the community can shop and get services and other things. The other part is the way the buildings are designed. There will be a campus quad in the middle that is open to the public. We will be hosting events. Ideally, I'd love to see concerts and other things that the community would come into that campus and see it as a public resource for them. There will be art in there as well. And so we're really trying to think about this as an open place, much like a park in the interior that happens to have a hospital and a medical school around it.
You know, the Jamal Smith, who leads the Indy Health District, was very instrumental in helping Generations to identify their location. And of course, Generations is the new mission-driven bank that Old National invested in right there in the corridor as well. And so I think it's consistent with what you're sharing right now, this thought around making sure that your approach is very holistic. So we're not just thinking about health, but we're thinking about wealth. We're thinking about finances, jobs, all of the things. And then you're going further and incorporating the social aspect of it. And I think that's really powerful.
And we're, I would say, Thomas, the work in the health district will go well beyond the time that we build the hospital. So I love a good party. So we are hoping to have
He's a great DJ.
a whole lot of opening events. And I was fortunate to be a part of some bigger projects earlier in my career. There's nothing better than taking every person who worked on the project and asking them to bring their families to come walk through and show their families the work that they've done. So we will have a contractors day where everybody will bring through their families to show them their role and part in the building. We will have a community day so that the community can actually see the asset that's built in their neighborhood. And then I think our own employees are really curious. If you don't work at Methodist or university, it's still part of IU Health. And so they want to see that as well. So we'll try and plan a series of events before we actually start taking care of patients.
So all these great ideas, I know they're all your ideas.
No. I got a team. What I try and do is inspire them to say, how do we say thank you and recognize people? People have put up with a lot of stuff with us. I get a lot of love letters about Capitol Avenue being closed. And at some point,
I would have written one. And I was in a hurry to go downtown, and I got routed. But that's okay.
That's okay.
That was yesterday. We're talking about tomorrow.
Part of it is then you have to say thank you for putting up with us over these past couple of years. Come see what we're doing differently. And, I think, Andrea, your question around why do we do or how do we pick what we're doing? Jamal has done an amazing job with our other anchor partners in the health district, whether it's the Children's Museum, Ivy Tech, Citizens Energy, the IU. To actually engage the 5 neighborhood associations to say what's most important to you as we go through this. And so they've helped prioritize the idea that they said the most important thing we need is housing. And so for us, that has been a really critical kind of priority. And how do we actually see new affordable housing going up in that neighborhood? They have said food access, and they have been really specific. We want a grocery store. So I think Jamal knows more about the grocery store business than
he ever thought he'd learn.
Anybody who's never worked in a grocery store. And it's sort of interesting. We have this goal to say we will get a grocery store. All of them have said you need a certain density of housing in the neighborhood. So they, in that business, talk about how many door fronts do you have, because that'll justify having a grocery store. So now we know what they need. So we're looking to build enough housing and partner with people who do that. IU Health is not a construction company, as much as people may think that. We don't want to be in the housing business, but we do want to encourage people to build housing in our community. So I think that listening component, going back to where we started, for us has been really important with those neighborhood associations and key individuals who have lived in those neighborhoods for a long time, saying, what do you want? And what we heard right away was, listen, we don't need another study. We got shelves full of studies. We need people who are actually going to do something and make a difference. And Jamal's been phenomenal in that, whether it's our investment at Crispus Attucks, which he has personally shepherded through some of the housing that's already been developed or is under construction right now. And we've got some plans for some more. So I just think continuing to say this work lives on after the building opens is going to be just as important as getting the building done.
The partnerships and the relationships, that are growing, being created, and that will sustain the neighborhood and all of the investment that's being made. It's really powerful. We're going to say something. I'm sorry.
No. I'm just saying that I'm glad we've gotten him here today. And one of the best things about a podcast is you're meeting people you didn't already know. You're finding out things that's going on in the city and surrounding areas. And hopefully this podcast will enlighten people, and especially the old folks that don't like AI.
I have one last question before we wrap up.
All right.
Okay, this is a question for those over 50, but really for anybody who might be listening. Because you lead such a large organization that drives enormous impact, I believe IU Health is the largest healthcare system in the state of Indiana.
Correct.
Right. So 39,000 employees, lots of impact throughout the state and certainly in central Indiana. As the leader, Dennis, share with us one of your, how you think about leadership. What is your approach to leadership, and what would you share with our audience as folks are thinking about transitioning into retirement, transitioning to different phases of their lives, thinking about their role in leadership? I'd love to hear your thoughts.
So, I think I learned pretty early on, even in smaller organizations, you can't manage that many people, right? So what you have to do is sort of clearly define what is a goal we can all kind of say is our purpose for being here. And at IU Health, our goal is how do we make Indiana one of the healthiest states? So every employee has an ability to help in that mission. Then we talk about our culture and really saying, what do we expect everybody to do and how do we expect them to behave? Because I'm a big believer, I don't really like policies and procedures and rules. But if you think about our four values that really drive our culture of be purposeful and realize you're here to make a difference in people's lives, be a good teammate and help others around you, be compassionate, so have empathy, but do something about it.
Right.
And then excellence. All of us can get better, and really that idea of continual improvement. Those two combined really, I'm grateful. I've been singing that mantra for a decade now. That I don't know that all 39,000 people know that, but I bet you 30 do. 30. And so I think that is kind of because what you want to do is you want to move the whole place north and make sure we're not going the other direction or sideways. And so the power of that many people all moving in the right direction, trying to do the right thing, is what's really exciting about the job. And so my leadership role is really communicating that over and over again. Why are we here? What's our purpose? How are we all going to do our work together? And then give them examples of where that's actually working and making a difference. And so everything we've talked about today fits into either our mission and our goals or kind of the way we want people to do our work. So that's the gratifying part, is I kind of get to set that general direction and then watch really talented, creative people envision how they can do that in their space.
Love it. Thank you. Amazing.
So there was a period of time where I was transitioning between the radio station and I worked at the Center Township Trustee's office, and I had different jobs. Well, there was a period of time I did not have a job. And so I was fortunate enough to be able to sign up for MDYs. I think that's what you call it. And it was the greatest thing I ever did in my life, because I really don't go to the doctor, and a lot of Black men don't. But that almost forced me to go. I think I paid $5 a month or something like that. And I got full coverage. I got dental and medical. And so that's when I really started going to the doctor, because I really hadn't gone before. So is there something like that that's going to come back, or is there something out there that's going to start up? Because I believe that organization no longer exists.
Yep. Yeah. So that was actually a partnership between IU Health and Eskenazi Health.
Oh.
We each own that, and then we decided to get out of that business because we wanted to be less in the insurance business and more in the caring for patients business. And there are some other options that are available on the marketplace. So each year you can re-enroll. What I would say is it is one of the most complicated things to figure out is what insurance is available, what am I eligible for, what's the right need for me. Because while you and I are over 60, there may be somebody who is under 65 who is in the commercial space versus we qualify or pretty close to qualifying for Medicare. I would say every hospital has financial counselors. And we have over 50 of them, I believe, at IU Health, that their job is to help people figure out their insurance.
Okay.
Like they will sit down and say, tell me where you work, tell me how much you make, tell me where you live so we can make sure they have doctors close by you. They want people to find insurance, and their job is to help you navigate a really complicated system. And that's not just at IU Health. I would say if you get your health care at St. Vincent's or community or elsewhere, they have those same people because we talked earlier, my mom's 89. She lives up in Chicago. I go up to visit every 3 or 4 weeks. There is a stack of bills on her dining room table for me every time I go there to say, can you help me figure out how much do I owe and who do I owe it to? So that part of healthcare, I think, is really complicated. And I would say, don't be afraid to ask for help.
Okay. Because it's kind of heartbreaking when you know you don't have it and you don't know where it's going to come from. And during that period of time, I did not have a job at all. And so it just made it a little bit more difficult.
Yeah. And what's in Indiana, virtually everyone qualifies for some kind of health insurance.
Okay.
It's just you got to be willing to navigate the system. And that's really hard, and you need a partner. And that's why I think these financial counselors do amazing work. They get joy out of seeing people get connected to healthcare. So like you said, you didn't go as much when you didn't have insurance as until you did. And so that's part, again, for us. When we talk about what's your purpose, figuring out people's insurance status doesn't feel like it's a medical job, but it is one more way of how we're making Indiana a healthier place. Is if you get people access to insurance, they get access to healthcare, they're going to be healthier.
Yes.
And so that job may be almost as important as a medical assistant in a clinic or a nurse or a doctor, because you're getting over the first really big hill, which is I got to get you to go to the doctor.
Yeah.
Right. Having access.
Yeah.
And thinking proactively. So maybe before there's a need, trying to work with the counselor.
Again, I've talked to a number of those folks. They get joy out of hearing people say, I finally got insurance.
Yeah.
I can now get care. That's why they do what they do every day. They really want to make a difference.
So, Dennis, what do you believe is the best thing that we can do to make our listeners and our viewers the second half of their lives the better half?
I think we talked about a lot of things today. I'll go back maybe to yours, which is make sure you have a primary care doctor, primarily for screening and just knowing your health. I would say be active, and whatever way that means, that brings you joy. The other is don't be isolated. So have a network of people that you're interacting. And then I think you need purpose in your life, and whatever that is. And that may be caring for your grandchildren. That may be going to work every day still. I have a friend who is a retired doctor, and 3 days a month, he goes to a veterans home to take care of people there. So it doesn't have to be every day, but it's got to be something that gives you that sense of purpose and value and meaning, because that, I think, is what we're all looking for. I don't care what age you are, but I think it gets more important as you get older, that we used to view our purpose in life as the work we did.
Right.
And you got to find something else. It may still be work, but if it's not work, it's got to be something else.
Right.
Love that. Thank you so very much, Dennis Murphy. We really appreciate your time. I think the takeaways for our audience today are maybe the 4 pillars that you discussed, that you lead the employees of IU Health with, which are purpose, teamwork, working from a place of excellence, and then what was the
compassion?
Compassion, which is maybe the most important one of all. So, or very foundational to the others. So, thanks again. We will use those takeaways and share those with our audience. We appreciate your time today.
So much.
It is a sincere honor, and thank you for making this really fun. I really appreciate it.
Thank you.
Fantastic.
Is that good? Or do you need to redo it?
I did it.
All right, very good.
Good.
The Second Half Podcast, powered by NO Power, Lim Studios, and the Indianapolis Recorder.